to bone physiology. Bone, all of you know that bone is a connective tissue which is made up of by mineral deposition. The main protein which is present in the bone fiber is oosin, O-S-S-E-I-N, oosin. Along with this protein, two other proteins are also present, but they are in negligible amount. Bone are continuously destroyed and renewed, so we can say that bone are the dynamic portion of body, not the inert one. Bones are continuously renewed and destroyed, so we can therefore say that bones are dynamic. For example, dynamic personality is हर वक्त मूव करता रहता है, भागता रहता है, तो bones भी हमारी dynamic है, inert नहीं है. If we talk about composition of bone, it is comprising of water, inorganic and organic matter. Water will cover 25% of bone, while inorganic matter, which are including calcium and phosphorus, about in 45%, while organic matter, which is comprising of protein, oosin and mucopolysaccharide. Inorganic matter is calcium and phosphate, while organic matter are protein and mucopolysaccharide, which will cover 30% of the portion in bone compartment, while within this 30%, 95% is covered by oosin protein. Keep remember, end of long bone is a cartilage. During the developmental stage, end of the long bone or large bone is cartilage, degenerated and replaced. It is degenerated and replaced by osteoblast. Osteoblast produce organic matter in it, which is termed as osteoid tissue. So, end of the large bone are cartilaginous. These are degenerated and replaced by osteoblast cell. Blast and class 2 type of cells are present in the bone. One is related, blast is related with the regeneration, and degeneration occur with the help of blast cell. So they produce organic matter, that is termed as osteoid tissue. Also bring some seeding of inorganic calcium and phosphorus. Seeding means उसको कवर कर रहा होगा, inorganic calcium and phosphorus भी इसके अंदर लग रहा होगा. Along with mineral deposition, glycolysis and production of organic phosphate take place in osteoblast cell. Along with mineral deposition, glycolysis and production of organic phosphate take place in osteoblast cell, and these osteoblast cells containing an enzyme which is known as alkaline phosphatase, ALP, which is responsible to split organic phosphate into inorganic phosphorus that will deposit on the bone. There is an enzyme in the osteoblast cell, that is alkaline phosphatase, ALP. It is responsible to synthesize or convert organic phosphate into inorganic form, so it will be deposited in the bone. This enzyme also acts on pyrophosphate, that is responsible for the demineralization of bone. That is responsible for the demineralization of bone. So therefore, ALP having diagnostic diagnostic significance, and have major role in regulating bone remodeling or mineralization. Okay? ALP provide inorganic phosphate from pyrophosphate, which I just told you that it gives you inorganic phosphate from pyrophosphate and organic phosphate for the synthesis of bone crystal. Bone crystal means what is the reason that we need organic phosphate? Organic phosphates are required to crystallize the bone with the help of calcium hydroxide and calcium phosphate. ALP are of different type. Alkaline phosphatase. It is present in the bone. It is present in the liver. Usually in the bone, it is present in the outer layer. It is present at the outer portion of the bone. Now, what is the role of crystallization? Mineralization भी हो रही है, और फिर pyrophosphate जब break हो रहा है, उसके बाद वो crystallization कर रहे हैं, calcium hydroxide and calcium phosphate को crystallize कर रहे हैं, bone के ऊपर cover कर रहे हैं उसको, so bone will become dense by the crystal growth and displacement of water. अगर water content ज़्यादा होगा तो बोन कमजोर होगी, डेंस नहीं होगी। तो जैसे जैसे एज बढ़ती है, ग्रोइंग एज से बाहर निकलते हैं, तो फिर बोन एक खास लेंथ तक बढ़ती है एज में। जब आपके इंस्ट्रूमेंट प्रोजेस्टेरोन सारे एक्टिव हो गए वो हार्मोन जो है वो एक्सेसिवली रिलीज हो रहा है। आफ्टर सर्टेन एज बोन्स विल नॉट इंक्रीज इन द लेंथ बट इंक्रीज इन द विड्थ। ठीक है? Therefore, in elderly age, you will feel that your bony structure is now broadened rather too elongated. एक खास growing stage तक वो elongated होगी और cartilage होगा initial stage जब बच्चा born होता है तो cartilage होती है, इसकी soft bones होती है। ये soft bone osteoid tissues में convert होती है जो मैंने अभी आपको बताया जिसमें organic phosphate भी होता है, inorganic phosphate भी होता है और alkaline phosphatase जो है ये maintain रख रहा होता है चीज़ों को कि ये इनऑर्गेनिक फॉस्फेट पायरोफॉस्फेट को भी कन्वर्ट करता है, डीमिनरलाइजेशन भी कर रहा होता है और ये कहाँ लेके जाता है? ये सारा कैल्शियम एंड फॉस्फेट ये आपके सर्कुलेशन में भी लेके जाता है और सर्कुलेशन में जो कंसंट्रेशन ऑफ कैल्शियम अगर आप कभी देखें किसी को कोई ऑस्टियोपोरोसिस का प्रॉब्लम हो या कोई और प्रॉब्लम हो, कैल्शियम कम हो तो उसकी कैल्शियम चेक की जाती है ब्लड में। बोन डेंसिटी इज अ डिफरेंट थिंग लेकिन ब्लड में चेक की जाती है, वहाँ से पता चलता है कि कोई प्रॉब्लम अल्कलाइन फॉस्फेटेज। इसके अलावा अल्कलाइन फॉस्फेटेज को देखा जाता है कि अल्कलाइन फॉस्फेटेज की एक्टिविटी हाई तो नहीं है, हाई है तो इसमें कि या तो कैल्शियम डेफिशिएंट हो रहा है या फिर एंजाइम जब भी एक्टिवेट होगा और इसका काम मिनरलाइजेशन का होता है तो या तो एंजाइम डेफिशिएंट कैल्शियम डेफिशिएंट है या फिर वाटर में डी नहीं मिल रहा। तो ये सारा प्रोसेस bone remodeling का it is a controlled mechanism which is depending upon the activity of enzyme. It is depending upon the concentration of calcium and phosphate in the blood as well as it depends upon the acceleration of different hormones which are regulating bone mineralization. Is this clear to all of you? Now come to the action of calcitriol. What is basic role of calcitriol, which is the active form of vitamin D, which we are discussing since the previous lecture. The very first function of calcitriol is the formation of two calcium binding proteins. Two calcium binding proteins which are known as calbindin. Calbindin 9K and 28K. And where it formed? These proteins are formed in the intestine. So therefore, they can increase calcium reabsorption. They can increase calcium reabsorption from the intestinal wall. The second important function, it increases reabsorption of calcium and phosphate from the renal tissue. Means it will not allow calcium and phosphate to be eliminated from the renal pathway, but once it is passed from the glomerular filtration, it will be reabsorbed. So this is the second function of calcitriol. Third function, it increases mobilization of calcium and phosphate from old bone, means stimulate both bone forming and bone mobilizing osteoclast cell. Osteoblast and osteoclast. It is increasing mobilization of calcium and phosphate from old bone, means it stimulates both bone mobilizing osteoblast cell. So the net activity is a clast activity. Net activity is a clast activity. The fourth important action of calcitriol, all the discussed actions of calcitriol raised by calcium and phosphate level. Calcium and phosphate level. Means whatever the function or whatever the action of calcitriol is related to increase the level of calcium and phosphate. This is the main phenomena behind absorption of calcium. Whenever calcium is mobilized and taken from the intestinal lining, phosphate will move with the help of a co-transport mechanism. Okay? The fifth function, calcitriol exerts anti-proliferative effect on parathyroid activity. Anti-proliferative, proliferation is the what? Proliferation. So calcitriol exerts anti-proliferative effect on hormone parathyroid. Parathyroid activity is stimulated when body has less vitamin D. When body has less vitamin D or hypocalcemia or hypophosphatemia. So what will happen? Hyperparathyroid hormone activity is observed when there is less vitamin D, because it is having role to stimulate the modeling of bone, remodeling of bone and synthesis of mineralization of bone. Now come to the main mechanism of action of calcitriol. I told you कि ये कैल्वेंडन प्रोटीन सिंथेसाइज कर रहा है, ये पैराथायरॉइड को इंक्रीज कर रहा है, ये रीनल से भी इंक्रीज कर रहा है, ये ब्लॉक कर रहा है कैल्शियम एंड फॉस्फेट को, उसी सूरत की ये जाने नहीं दे रहा, कहीं से भी बाहर नहीं निकलने पाए, ट्रैप कर रहा है कैल्शियम को और फॉस्फेट को, ताकि बोन की मिनरलाइजेशन हो और साथ ही साथ ये क्लास सेल की भी एक्टिविटी करता है, ताकि जो ओल्ड बोन का कैल्शियम है और फॉस्फेट है वो भी मार्केट में आ जाए और उसको भी वो यूज करते हैं। अच्छा, अब ये किस मैकेनिज्म से करता है? The mechanism is induction of gene for the osteoblast forming protein, number 1. Induction of genes means basically it is inducing the genes for osteoblast forming protein. Second, it is inducing gene for calcium binding protein 9K and 28K calvendin, which I discussed in the beginning. And the third mechanism is to induce the gene in parathyroid. Induce the gene in parathyroid to decrease the synthesis of parathyroid formation, so that the net effect is controlled. So the main function of this vitamin is to regulate calcium and phosphate metabolism. Second is to express the gene for the calcium binding protein. Third function is the mineralization of bone. And another important function is to synthesize 24-25 dihydroxy vitamin D. What is it? 24-25 dihydroxy vitamin D. It is the storage form of vitamin D which is less active than 125 dihydroxy. That is the active form. So what it will do, it will deposit hydroxyapatite in the bone. Vitamin D is also believed to promote bone resorption and calcium mobilization. It is believed to promote bone resorption and calcium mobilization to raise the level of calcium and phosphate in the blood. Calcium and phosphate in the blood in association with parathyroid hormone. And once it is increased, it will give a feedback inhibition on the further activation of calcitriol. Is it clear? Now come to daily recommended allowance. It depends upon certain factors. क्या factors हो सकते हैं? Age, sex, season, and interaction with the sunlight, which is very important. So the factors which are responsible to change the daily recommended allowance is the age, sex, season. Means cold weather and cloudy weather, there is no vitamin D synthesis can take place with the ultraviolet radiation. So in that case, we have to take a good amount in terms of supplementation, rather food. And exposure of light is also very important. If we talk about women requirement at the age of 1 till 70, 15 microgram or 600 international units per day are required. While above the age of 70, 800 international units per day is the requirement. While the same requirement of vitamin D is for men. Up till 1 to 70 year of age, कितना होगा? 600 or 150 microgram, 600 international unit. और age 70 से above हो गई तो 800. For breastfed babies, supplementation is essential and recommended because breast milk is the poor source of vitamin D. While in children up to the age of 12, 400 international units are required on daily basis. Now come to the blood levels. Blood level above 20 nanogram per ml to 30 nanogram per ml are considered as sufficient. In how we can see the picture of calcium and phosphate in our body. So we need to take blood sample and identify by the biochemical analysis the concentration of calcium in the blood. So 20 nanogram till nanogram per ml, say 30 nanogram per ml are considered as the sufficient amount of vitamin D. While vitamin D deficient people need 5,000 international units to reach the blood level above 30 nanogram per ml. Vitamin D deficient person needed 5,000 international units so that the blood level can reach above than 30 nanograms per ml. Postmenopausal women with vitamin D level, postmenopausal women with vitamin D level below 20 nanograms per ml ingest 800 to 2,000 international units that will raise their blood level up to 20 nanograms. However, higher dose is required if we need to increase the blood level up to 30 nanograms. Is this clear? Now come to the deficiency signs. Two major problems will arise due to the deficiency of vitamin D, which are related with the bone. One is associated with children and one is associated with adults. Rickets is the disease in the growing children when there is deficiency of vitamin D. Rickets is the problem that arises in growing children when there is deficiency of vitamin D arise. Low vitamin D intake results low calcium and low phosphate, which stimulate parathyroid hormone, and that acts to restore the plasma calcium from bone and in infant newly formed osteoid tissues. So once there is vitamin D deficiency, the newly osteoid tissues are unable to mineralize. Cartilaginous bone unable to mineralize, mineralization नहीं होगी, vitamin D नहीं होगा, तो calcium and phosphate भी नहीं होगा, जब वो नहीं होगा तो mineralization नहीं होगी, osteoblast cell नहीं बनेंगे, osteoid tissues नहीं बनेंगे, जो कि regenerate होके cartilage को convert करते हैं thick bone में adhesion. So bone have less inorganic matter that decreases mineral contents, of bone, and it is considered as the first defect. And cartilage cell at the end of long bones do not degenerate. The cartilaginous cell at the end of long bone do not degenerate, but they proliferate and raise the level of alkaline phosphatase. That is the main enzyme. Whenever there is vitamin D deficient or calcium deficient, it is responsible to take or act on the pyrophosphate to give phosphate for the blast activity and blast activity. So the signs and symptoms which are arising in rickets, including, you will see the picture in slide. I have given two long bones. One is a normal one, another one is the defective or rickets patient bone. There is slight bend in the long bone, specifically the legs bone. Bone will become tender and faint. They grow slowly. They bone and curve the leg. Muscle weakness will also arise. And those bones which are soft, they can easily break. There is abnormal shape of ribs and breastbone. Wide joints in the elbow and wrist. A large forehead and abdomen. It will also affect on the dental enamel that will arise in terms of cavities and irregularities in the dental mass. Now, if we diagnose rickets, the plasma calcium level initially low. Plasma calcium levels initially low, but later they increase due to parathyroid activity. Parathyroid activity, while serum alkaline phosphatase or ALP is increased in the rickets, which have been diagnosed as enzyme is removing phosphate from organic phosphate, which I told you in the beginning. Okay? So the first diagnosis, initially calcium levels are high. If we have observed and identified this problem at the early stage immediately, so we will find low calcium levels as well as increased parathyroid hormone activity, because whenever there is calcitriol concentration is lower in the body, it is a positive stimulus for the parathyroid to release. So therefore, the parathyroid activity seems to be high. While when there is increased calcitriol level in the body, so it produces an inhibitory effect on the parathyroid hormone to minimize the release and concentration. While alkaline phosphatase is increased in the rickets, and which is having diagnostic value as enzyme is removing phosphate from the organic phosphate, because it is going to synthesize and remodel bone on the basis of its act on the pyrophosphate to take the minerals from the pyrophosphate and give it to the bone. Defective enamel production is another way to diagnose rickets. Poor musculature and fat belly appearance in the children. Fat belly appearance, tummy large हो जाएगी, musculature weak होंगे और ribs का shape वो नहीं होगा जो actual में होता है. It is important that rickets should be diagnosed very early. Once the bone will synthesize or bend, it can never be changed. It is necessary that it should be ruled out. It will be ruled out and diagnosed in early stage, because once bone develops, it is difficult to reverse the rickets. Rickets is also seen when there is defective vitamin D conversion. When there is defective vitamin D conversion from its inactive to active form. Now come to osteomalacia. It is a problem of bone due to deficiency of vitamin D arise in adults. In other words, in some books you can find that it is adult rickets. Okay? Adult rickets. Usually it affects women who are economically poor and undergone into repeated cycle of pregnancy and lactation, because it will put burden on them. Excessive repeated cycle जब pregnancy के होंगे, आप देखें वो वाली खवातीन के बहुत सारे बच्चे होते हैं, वो बड़ी बोन की एग की वजह से, बोनी प्रॉब्लम्स की वजह से, ऑस्टियोपोरोसिस की वजह से बहुत परेशान रहते हैं, क्योंकि वो कैल्शियम के लेवल मेंटेन नहीं कर पाती और रिपीटेड साइकिल में आपका कैल्शियम और फॉस्फेट पूरा एम्ब्रियोनिक डेवलपमेंट में इन्वॉल्व हो रहा होता है। और इसी तरह से फिर लैक्टेशन पे जब लेके जाते हैं तो उसमें भी ऑल्दो इट्स अ पुअर सोर्स, बट बॉडी का कैल्शियम तो निकल जाएगा उसमें से। तो यूजुअली ऑस्टियोमलेशिया जो है, इट हिट्स वुमेन दोज हु आर अंडरवेंट into repeated cycle of pregnancy as well as lactation. In the process of mineralization, the inner layer, which is comprising of collagen, in the process of mineralization, the inner layer, which is comprising of collagen, normally becomes coated with the minerals. that form a hard outer shell. That form a hard outer shell. When people have osteomalacia, the shell does not form fully. The shell does not form fully, leaving the collagen soft. Leaving the collagen soft. Now, what are signs and symptoms in osteomalacia? There is pain in the legs, upper thigh and knee. There is pain in the legs, upper thigh and knee. Weak, sour and stiff muscles. Difficulty in walking. Pseudo fracture of weight-bearing bones. Pseudo fracture of weight-bearing bones such as feet and pelvis. इसकी पूरी बॉडी हमारी इस pelvis एरिया पर डिपेंड कर रही होगी. ऊपर का पूरा आपके नीचे की जो legs आ रहे हैं bodies के ऊपर प्रेशर कर रहे होते हैं. Keep remember, it is observed several times कि जिनमें कैल्शियम कम हो रहा था या फॉस्फेट कम हो रहा था या मिनरलाइजेशन सही नहीं हो रही होती, तो आप देखेंगे कि इमीडिएट जो चीज ब्रेक होती है वो आपकी हेड बोन होती है. और once it's break, it is difficult to recover from that position or that situation, and ultimately some of the people I have seen, they expire due to this reason. So it hits your pelvis immediately. Although if it is controlled by taking supplementation, so we can minimize the process, but still some of the female will feel that there is pain in the neck, pain in the shoulders and in the vertebral column, specifically the lower vertebrae and cervical vertebrae. That is the reason of osteoporosis. Means remodeling में bone की जो synthesis activity है वो कम हो जाती है, means उसका resorption कम हो जाता है, but desorption high हो जाता है. ठीक है? Desorption जो उसमें से निकल रहा है वो process हम नहीं रोक सकते. इसके लिए रोक सकते हैं कि अल्कलाइन फॉस्फेट जब देखते हैं विटामिन डी कम है, कैल्शियम कम है, तो वो बोन की डीमिनरलाइजेशन क्लास्ट सेल के थ्रू कर देता है. तो आपको कैल्शियम का जो कंसंट्रेशन है, फॉस्फेट का कंसंट्रेशन है, वो ब्लड में तो ज्यादा मिल रहा होता है, बट बेसिकली इट इज बिकॉज ऑफ द बोन desorption, not resorption. Okay, is this clear to all of you? अच्छा, important thing in osteomalacia that sometimes such type of problem can never be seen in terms of signs and symptoms. Means people sometimes are asymptomatic if there is osteomalacia. It can also happen. So it is necessary that after the age of 40 years, we need to take a regular examination of some important things. For example, in case of female, mammogram is necessary, their ovarian tests or ultrasounds are necessary, as well as their bone density and bone mineralization and calcium concentration determination is also important. And another important thing which is helping us to determine if there is any problem. What is this? That enzyme name I told you to check the ALP, alkaline phosphatase. Okay, other clinical aspects of deficiency which you will find rarely in different books, but I searched from the different literature that heart ailment. Vitamin D deficiency is indicator of future heart attack. Vitamin D deficiency is the indicator of future heart attack. Then cholesterol. Diabetes, which is insulin dependent type 1, occurred commonly in the area which receive less sunlight. These are the other clinical aspects of deficiency. Breast cancer has vitamin D receptor that can be slow down cell cancers. PAD, peripheral artery disease, which I discussed several times with you in the first semester as well as in the last class, that peripheral artery disease is basically the arterial stenosis, narrowing of the artery. It is also observed that vitamin D may protect against an arterial disease in which fatty deposition is restricted and blood flow to the limb is restricted. So vitamin D is helping to minimize peripheral artery disease. So have you observed that ये जब कोविड गुजरा था पूरा उसमें विटामिन डी, विटामिन सी ये सारे एंटीऑक्सीडेंट भी हैं. चूँकि बोन का पेन था, डीमिनरलाइजेशन फास्ट होती है इसमें, तो आपको विटामिन डी का सप्लीमेंट लाजमी कहा गया था जिनको के कोविड हो गया या कोविड के अटैक कर चुके थे, तो उनका लेवल भी मेंटेन रहा और उनको जो सिम्टम्स आए वो भी लेस डैमेजिंग थे एज कम्पेयर टू दोज जिन्होंने अवॉइड किया. सप्लीमेंटेशन इज नेसेसरी व्हेन देयर इज रिक्वायरमेंट, otherwise we can manage our daily requirement by taking foods. Acha, now come to prevention and treatment. The goal of treatment and prevention are the same. Goal of prevention and treatment are the same: to reach and maintain an adequate level of vitamin D in the body, taking good sources of food, but no ultraviolet interaction may not have to cover the deficiency of vitamin D. So in that case, supplementation is must. Vitamin D लेते हैं but sunlight ना means अगर बॉडी के अंदर सिंथेसाइज हो रहा है कोलेस्ट्रॉल है but sunlight नहीं होगी तो वो उसकी एक्टिविटी होगी नहीं, वो एक्टिवेट होगा ही. Now come to hypervitaminosis. We have discussed the problems which are arising due to hypovitaminosis. Hypovitaminosis or vitamin D toxicity is rare but potentially serious. The main consequence of vitamin D toxicity is a build-up of calcium in your blood, which is called as hypercalcemia. The main consequence of vitamin D toxicity is a build-up of calcium in your blood, which is termed as hypercalcemia. Taking 60,000 international units per day for several months has been shown to cause toxicity. This level is many times higher than the US recommended dietary allowance for most adult 600 international units of vitamin D per day, which we have discussed in the daily recommended allowance RDAs. कि आपको ज़्यादा से ज़्यादा चिल्ड्रन में 400 है, 600 है और 800 है above age of 70. तो ये कई गुना ज़्यादा है. तो डेफिनेटली और कैसे हेल्प करता है मैंने आपको स्टार्ट में बता दिया था. बेसिकली कैल्शियम होता है जो कि आपको बहुत ज़्यादा हेल्प कर रहा होता है. अच्छा जी, ड्यू टू hypervitaminosis, the immediate effects which are observed in intoxication of vitamin D, including anorexia, that is loss of appetite, thirst, constipation, polyuria, excessive urination, which is followed by nausea, vomiting and diarrhea. These are the immediate effects. While delayed effects, which arise due to persistent hypercalcemia and hyperphosphatemia. Anemia means in the blood. Calcium level when high in the blood, we use the term hypercalcemia. And when phosphate level is high, hyperphosphatemia. Urinary lithiasis. What does it mean? There is a stone formation in the urinary tract, metastatic calcification, Metastatic calcification, which will affect kidneys, bronchi, muscles, arteries, gastric mucosa, and renal failure may develop that can lead to cause death. Is it clear? Main problem जो hypervitaminosis की वजह से होगा, एक immediate और एक जो है वो delayed effect. अगर लंबे ऐसे तक इसी वजह से खास तौर पर I will recommend everyone कि जब भी कैल्शियम का सप्लीमेंट आपको लेना पड़े, क्योंकि बहुत सारे लोग जो है वो डाइटरी सोर्स से नहीं ले पाते कैल्शियम. मीन्स फॉर एग्जांपल मिग्रेन है, मुझे मिग्रेन है तो मैं विटामिन डी तो ले सकती हूँ बट मैं कैल्शियम नहीं ले सकती. और विटामिन डी अगर बन रहा है तो वो कैल्शियम जब तक नहीं लेंगे हम उसका कोई गुण नहीं होगा, फायदा नहीं होगा उसका. तो कैल्शियम सप्लीमेंटेशन इज ऑल्सो नेसेसरी. अच्छा, अब अगर विटामिन डी में लेती चली जाऊँ विद कैल्शियम, इसीलिए आप विद कैल्शियम आता है ताकि आपका कैल्शियम सप्लीमेंट जाए. और कैल्शियम हमें कहाँ से मिलता है? हमें डेयरी प्रोडक्ट से ज़्यादातर मिलता है, ज़्यादातर हमें डेयरी प्रोडक्ट से मिलता है. तो अगर हम जो है वो डेयरी प्रोडक्ट नहीं ले पा रहे ड्यू टू एनी इलनेस या फिर बात लोग जो है वो लैक्टोजन इनटॉलरेबल होते हैं, वो नहीं इसको टॉलरेट कर पाते, तो उस सूरत में या फिर मिग्रेन है कि डेयरी प्रोडक्ट्स नहीं ले सकते, उनको वो हिट करता है. In that case, supplementation is required continuously. But you must need to advise the people that they need to switch sometime, go for the rule out of their calcium concentration and phosphate concentration in the blood, and then will restart. Because excessive calcium absolutely going to develop in the later stages or in the chronic use or after the chronic use, what? Urolithiasis and other problems, that is the deposition of these calcium into the alveoli, into your arteries, into your urinary tract and all the soft tissues. And once the renal failure occurs, that will be the leading cause of death. So here we have finished vitamin D. If you have